All right. Welcome once again, our dear viewer, to Budget Cafe Discussions, a platform which bridges the knowledge and awareness gap regarding the budget making space here in Kenya.
Greetings, viewer. We want to welcome you to today's session where we are discussing the program-based budget for Machakos County. So it is good to let you understand how the content, what is supposed to be there. And before we got here, we started on another key government budget documents. One thing that we should know is that the program-based budget is found in the formulation stage. So people start they start engaging in the annual development plan, and then after that, the CBROP, the county budget review and outlook paper, and then after that, the county fiscal strategy paper, and then now the program-based budget. So now the program-based budget shows you where the money goes. And at this stage, once this program-based budget is taken to the county assembly and approved, it becomes the Appropriation Act, which means that will be the budget that will be used for the coming financial year. So, with us here is also a budget champion. Her name is Beatrice. Beatrix, you can maybe say hi to the viewers before the other budget champions join us.
Good evening, everybody. My name is Beatrice Nzou, a budget champion based in Machakos.
Great, great, great. So, so let us just get now to understand what is program-based budget. So we can start off with a program. So the definition of a program, it is a group of independent but closely related activities designed to achieve a common objective. And a program can be described as a meaningful and manageable group of activities that directly or indirectly contribute to the delivery of smart outputs. All right. So with us defining the program, what do you think a program-based budget is? So Beatrice, kindly share with us, what do you think a program-based budget is?
I think it will be the detailed activities that would be undertaken, and it should also show the amounts which will be spent on each activity.
Great, great. So, as you can see in the screen, it's a budgeting approach or process by which money is allocated in terms of clusters of related activities. That is programs. So you may find like maybe there is a health program, but now you find it is divided into sub-programs. So like promotive and preventive, you're going to see them further, or by functional areas with the main focus being placed on proposed actual results. So why is the program-based budget essential? It is needed because it improves efficiency and cost effectiveness in public financial management using techniques and planning frameworks based on international best practices. And it also improves resource allocation by identification, ranking, and prioritization of programs. And it also enables achievement of greater fiscal transparency, that is ready access to reliable, comprehensive, timely, understandable, and comparable information on government fiscal decisions, activities, and intentions. The other thing is that it is essential because it improves the efficiency of budget management by including performance information in budget documents to assist monitoring and evaluation. That is the reason why it is essential to have the program-based budget. So, is it like the context with regard to the program-based budget? It is a legal requirement under the Public Financial Management Act 2012 to present budgets in programmatic format. So each county should present its budget in a programmatic format, and the PBB is the main budget documents which must be submitted to the county assembly alongside other documentations. Each county department is therefore expected to prepare programs which have clearly defined objectives, are linked to specific outcomes, and have specified outputs with clear performance indicators and targets. Such programs submitted to county assembly must be consistent with the ones approved in the county fiscal strategy paper. So do you have any question till that point, Beatrice?
No, I'm okay.
All right. So this is the format of how a program-based budget should look like. Part A should have the vision, Part B should have the mission, Part C should have performance overview and background of programs, Part D should have programs and the objectives, and then summary of expenditure by program, summary of expenditure by vote and economic classification, summary of expenditure by program, sub-program, and economic classification, and then summary of programs, key outputs, and performance indicators. So we are going to look at the Machakos program-based budget for the financial year 2020-2021 that will serve as our case study, because the one that is supposed to be for financial year 2021-2022 has not yet been published.
Mm-hmm.
So Beatrice, which sector are you in?
Health.
Or you're in the health sector?
Yes.
All right. So what we are going to do is we are going to focus on the PBB with regard to health sector, so that at least you can be able to follow how money is being supposed to be utilized even in the health sector.
Okay.
All right. So this is a two-level health program structure. So there's the Department of Health. So like now Machakos County Department of Health, but it is divided into three. There is the one for general administration, there's one on curative care, and there's another program on preventive and promotive health services. And then under preventive and promotive health services, where you are in, we have family planning, maternal and child health. We have a sub-program on HIV/AIDS prevention and control, and we have health promotion, nutrition, environment, and health insurance. That is why it is called a program-based budget, because it focuses on even giving you more details with regard to where the money is going into with regard to programs, the different programs. So you can see here sample of programs and sub-programs. So program 1, preventive and promotive health services. Under it, there are 3 sub-programs. Sub-program 1 is HIV/AIDS prevention and control. Sub-program 2 is TB control. Sub-program 3 is other communicable diseases, including malaria control. Sub-program 4 is reproductive health, maternal, neonatal, child and adolescent health, which includes family planning, maternal and child health, nutrition, psychosocial counseling, including SGBV, mental health, school health, including oral health. And then sub-program 5 is environmental public health, which includes environmental health, epidemiology and disease control, health promotion, community health services, non-communicable diseases, mental health and medical rehabilitation. And then now we have the second program, which is curative and rehabilitative. As you can see from this, curative and rehabilitative. Because the one that I've shared first is this one, preventive and promotive. So now we are curative and rehabilitative. So with regard to curative and rehabilitative care, it is divided into two sub-programs: county referral hospitals and health centers and dispensaries. And then program 3, general administration, planning and support services. Here it has 5 sub-programs. So we have health planning and finance. So here we have health planning, finance, monitoring and evaluation, health sector coordination, where you even find the county health management team. And then sub-program 2, general administration, where we have administration, human resource for health, procurement. Sub-program 3, health commodities. Sub-program 4, research, quality assurance and standards. That is research, quality assurance, and then sub-program 5, coroner services or utilizing of the morgue. All right. So, Beatrice, if you look at this, where do you see which program are you in, and which sub-program? Or you can even introduce yourself so that people may get to know more about you, so that they can know why you are selecting which program and sub-program.
I'm supposed to be in mental health. Where is it here?
It is here.
And
preventive and promotive.
Ah.
And a sub-program 4 on reproductive health, maternal, neonatal, child and adolescent health, which includes family planning among maternal and child health, nutrition, psychosocial counseling, including SGV, and mental health and school health. So you are in the preventive and promotive health services sub-program.
Yes.
Preventive and promotive health services program. And with regard to sub-program, it is the one on sub-program 4 on RAMCA.
Okay.
So that is where you lie.
Okay.
Yeah. So Dr. Beatrice is a psychologist, so she deals with mental health. That is why she selected mental health, so that she may know where she lies. All right. Now, after that, the programs and the programs, they need to have their objectives. Okay? Because if you remember, when we had gone through the introduction, we had said that it needs to show us also programs and their objectives. Okay? So now, which is part D. So with regard to preventive and promotive health services, strategic objectives, it has a strategic objective and specific objective. So strategic objective is to reduce incidences of preventable illnesses and mortality at the county level. And specific objective is to minimize exposure to health risk factors, to halt and reverse the rising burden of non-communicable conditions, and 3, to eliminate communicable conditions. And then we have curative care program, whose strategic objective is to improve the health status of the individual, household, and the community in the county. And then the specific is to provide essential emergency and medical rehabilitative services, to provide essential healthcare medical services, and to reduce the burden of violence and injuries. And then sub-program 3, general administration, planning and support services. The strategic objective is to improve service delivery and provide supportive function to the county health sector. And specific objective is to provide leading role in policy planning of health services, to plan, monitor, and evaluate the health sector annual budget and expenditure, to monitor and evaluate the health sector activities, and to improve health infrastructure and to strengthen collaboration with health-related sectors. So welcome on board, Martin. I've seen you join. Karibu. All right. So,
thank you.
Karibu, karibu. So, before we get here to this group work, you have seen that one of the requirements of a PBB is that it should give us a summary of expenditure by vote and economic classification, which is part F. So this is how it's supposed to be. Part F, summary of expenditure by vote and economic classification. So you find here they have given the expenditure, current expenditure, and capital expenditure. So this is what they refer to as recurrent and development expenditure. So they give you like the approved estimate is how much, and then the estimates for 2017, 2018, and then now the projected estimates for the next 2 financial years. So as you know, the recurrent expenditure deals with payment of salaries, wages, and also operation and maintenance. Capital expenditure also deals with like construction, okay? So, and then there is also need for the program-based budget to also give us a sample summary of expenditure by program, sub-program, and economic classification. So it is supposed to appear like this, okay? So you can see like program 1, health administration services, they tell us the current expenditure, current transfer to government agencies, other recurrent, capital expenditure. This is the format it is supposed to be. It is supposed to be in, all right? So I have a question for you, Dr. Beatrice. So you are a health sector working group appointed to plan and budget for financial year 2020-2021. And you have the following data and priorities for budget allocation. So budget ceilings for financial year 2020-2021 is 2 million. You have 100 healthcare workers. 100 healthcare workers are available in the county, and you need 30 more. Each healthcare worker earns 8,000. And you need health commodities in the health facilities, and you need to buy diagnostic equipment for facilities that do not have. Only 30 of the 50 facilities in the county have diagnostic equipment so far. So, with regard to answering A, identify program, sub-program, and economic classification from each statement. So, like 100 healthcare workers are available in the county and you need 30 more. So, which program do you think they are in?
In the health sector.
Yes, in the health sector.
The level.
Yes, but which program? Because you see that now there's Department of Health, there's General Administration, Curative Care, Preventive and Promotive. Where do you think they are supposed to be?
Program 1.
Or General Administration. Yes, that is true. So that is where now you find like here General Administration, Administration Human Resource for Health, Procurement. So you find them here in the General Administration, Planning and Support Services. And then you hear that you need health commodities in the health facilities. You need health commodities in the health facilities. So which sub-program is it supposed to be in?
I think it is in it's supposed to be sub-program 3.3.
Yes. So you find that the health commodities, you may find it here in the preventive RAMCA, but you can also find it in general administration, because if you look at this, you will find that when you can even see here that health commodities sub-program 3, it is under general administration. All right. So you find it here as well, the health commodities. And at times you also find it here, like let's say for this one, for family planning. Family planning is about health commodities. So you find it in the RAMCA, and you also find it here in the general administration. So you find that It is in the Program 1, Preventive and Promotive Health Services, and Program 3, General Administration. And with regard to sub-program, Health Commodities is in sub-program 4, Reproductive Health, Maternal, Neonatal, Child and Adolescent Health, and on sub-program 2, on sub-program 3, on Health Commodities. Okay. So, right now, because of time, we are going to look at the program expenditure estimates by sub-programs and economic classification. So before we do that, we can maybe take an example of Nairobi County. We see how they broke theirs down, okay? So you see, like with preventive, are you able to see, or I zoom in?
Zoom in.
Okay, let me zoom. Is it better now? Okay, so you find that this is an example of expenditure estimates by program and estimates. So you see, like if you are looking at the health, when we get this one for Machakos, which we are going to get next week, because that is what we have been told by the clerk. So program 1, preventive and promotive. So you can see, and this is for Nairobi County, you can see the way they have broken it down so that you can know how much money is going towards HIV/AIDS. And they have said that HIV/AIDS is in sub-program 1, TB control sub-program 2, malaria control and others sub-program 3, RAMCA sub-program 4, where now mental health lies, and environmental and sub-program 5, environmental public health. And then now there's curative care and the general administration. So you can see for Nairobi County, they have really broken theirs down, and you can at least see where how much they are allocating. You can see, like if you're looking at the one where your mental health lies, which is your department, you can see that it's 2 million, and then 2021 they have given 2.4 billion, and then 2022 they have said that they allocate 2.3 billion, and then now there's the actual allocation. So they say that these are the requirements, what is needed. Like you find like each sub-program, they usually bring their budgets to the table. And when they bring their budget, that is not exactly what is allocated. Because one thing that you should know is that counties have scarce resources. Governments have scarce resources. So they have to use this money the way it's supposed to be. So you can see that even here in requirements 2021, they needed 2.2 billion, but the amount that they were given was only 875 million. In 2021, 2022, they had wanted 2.4 billion, but they were only given 923 million. And then for 2023, they wanted 2.3 billion, but they were only given 973. They were only given 973 million plus, all right? So, and so you can see now there's, so like Nairobi County, it gave program, sub-program, and it gave the requirements, how much each sub-program had requested for and how much was allocated, all right? So you can even see here program expenditure estimates by sub-programs and economic classification. So with regard to economic classification, now they are giving us, they are telling us, like this is still for Nairobi, they are giving us recurrent expenditure broken down, compensation to employees, it is like 30 million, like the resource requirements, 2021. But the actual allocated is half of that, which is 16 million, okay? And they have broken it down. This is for HIV/AIDS, and they have gone further to also break it down for TB control. And they will, and they have also broken it down here for preventive and promotive health services, all right? So you can see here for that one thing that they have also done is a program-based budget is also supposed to show you programs, sub-programs, and expected outcomes, outputs, and key performance indicators. So you can see here the one for Nairobi, the way they were there. The program Preventive and Promotive Health Services, sub-program HIV/AIDS Prevention and Control, key outcome, reduction of HIV-related mortality and new infections, key performance indicators, they were highlighted, and they gave even the targets that they want to achieve in the financial year 2019-2020, 2020-2021, 2021-2022, and 2022-2023, all right? So you can see the way they have broken it down. So that is the ideal, how it should be, okay? So now we are going to start looking at now the Machakos program-based budget for 2020-2021. What you can see here is for last year, let me zoom out here. Yeah, let me just zoom kidogo. So you can see this is a PBB. So they gave the vision and the mission of the health sector, which is universal leader in provision of holistic healthcare and emergency, and the mission as well. And then after that, they gave the program and their objectives. So in Machakos, you can see here at the bottom, let me zoom a little bit. You can see Machakos County has medical services and public health, 2 programs. Under medical services, they have general administration and support services, and preventive and promotive services, and emergency services. And then under public health, they have curative and rehabilitative health. So you can see how Machakos County has classified itself. And then you can see that they have also given an objective to ensure that health systems are adequately and properly facilitated. So this is how they have presented. This is how Machakos County has presented presented theirs, which is totally opposite with regard to this one, which divided into 2 programs, strategic objectives and specific objectives. Preventive, curative, general administration. So one thing that you should note is that each county has a different way of presenting their information. So for Machakos County, medical services, they decided that under medical services, they are going to combine preventive and promotive and general administration. And then now, public health, they gave this one for curative care. As you have seen in the present, are we together? Are we together there?
Yes.
All right. So,
Yes.
as you can see there, are we together, Martin? There. So
Yes,
now,
yes, I'm following.
now they have given the summary of expenditure by programs. So you can see here how Machakos County has presented its, like, you can find here like general administration. They have showed us like how much money they are allocating for financial year 2019, 2020, 2020, 2021 till 2023. And they have said like the total expenditure is for 2019-2020 is 2.8 billion. For program 2, curative and rehabilitative services, the total expenditure they had budgeted for is 991 million plus. And then for sub-program 3, promotive and preventive services, the total expenditure that they had given is 108 million, okay? And then for emergency services, sub-program 4, they gave it 24 million. Now, which brings now the total budget for that financial year for health to be 3.954 billion, okay? So, and you can see that most of the money is being utilized here in the general administration and planning. So, even if you look at this, you can even see, like, you know, like mental health lies here in the preventive and promotive services. So you can see how much it is being allocated as compared to the other sub-programs. So you find that if you are ranking, where can you rank where your sector is, where your sub-program is?
It has very little money. 108.
108. And you can see that even for 2020-2021, they had said that they are reducing it to 91 million, and then reducing it, and then increasing it to 96 million, and then 2022, they increase it again. But you can see 118.8 million, and it has to compete with curative services, general support. So it's like it ranks number 3 here, and then emergency services is the last one, which is receiving 24 million. Okay, so sometimes when you see that you are not getting certain goods, services that you want, it is because maybe of the money that is being allocated by the county. So when we'll be reviewing the program-based budget that is that will be released next week, these are some of the concerns that we will raise even in the memo. So Martin, are we together there?
Yes, yes.
All right. So right now we are going through the expenditure classification in terms of recurrent expenditure, program 1. So they are giving us now the amount that is being used for recurrent expenditure and current expenditure and development expenditure. Okay, so you can see this is for general administration and planning, and they have broken it down. So you can see it is 2.8 billion. Okay, it is 2.8 billion. And then if you look at program 2, curative and rehabilitative, they said that recurrent expenditure that they will use is like 660 million. Okay, 660 million. And then the capital expenditure 331 million. Okay, so at least we can see that the Machakos County government is giving us details of even how much they have said is going to pay to, it's going to go toward salaries. You see, like compensation to employees, 2.5 billion. They have given us that information. And how much is going to be utilized in purchase of goods and services and other current grants. Okay, so they have been transparent there. So if we look at the other thing, a county is supposed to give outputs and performance indicators. So with regard to Machakos County, you can see that they have, this is how they have done theirs. They have given program, key inputs, key outputs, and key performance indicators. And yet, in actual sense, it is supposed to look like this. Program, sub-program, key outcome, key performance indicators like this, and then they should give us target for that financial year and then the other 3 financial years. Like, so this is how they're supposed to look like. Programs, sub-programs, expenditure, and outcomes. But what we have right now here is this. So what do you think is missing here? You are mute, Dr. Beatrice.
I'm saying they are not even giving us the figure that the departments had requested for.
Okay. And then the other thing is they have not even given us the, you see, like giving us a target of how much should be allocated per year, the target that they are aiming to reach. The target that they are aiming to reach. You see, like you find here that they are saying that 300 health workers recruited on permanent and pensionable terms. So which financial year is that? If it is this financial year, so what is the target that you are also planning to reach for 2021, 2022, 2023? So that one is also missing, and it is something that is needed when preparing this. Martin, any comment so far?
No, I'm following Madam Violet. Huh?
All right, okay.
Yeah, this is educative.
Okay. So you can also see here, like this one for Machakos, you can see here that they are giving the summary of key outputs and performance indicators. So it's like they're mentioning how much money they used, support services, improvement of quality health services, and improved service delivery by to motivate health workers. So you can see here they are saying that for so far they have recruited 300 health workers on permanent and pensionable terms, and 500 health workers and paramedics trained. And they have said that 100 health workers have been promoted. And this is something that you're also not seeing in the other one. So that's why I'm saying that some counties are more comprehensive, others are not that comprehensive. Even when you look at curative and promotive, you can see for yourself that they had budgeted 761,876,660 curative and promotive. And they said that the objective was to access quality, efficient, and effective medical services. So they said 100% of pregnant women delivering in hospitals, from 80% of reproductive age women accessing family planning commodities. And they're also saying under 5 non-mortality, 100% of pregnant women attending antenatal care clinic. And then they're also saying construction, completion, and equipping of hospitals by 30th June 2021. And they have even given the words like Wamunyu, completion of Kaiani dispensary staff quarters, completion of Nyaani dispensary, and Tala, completion of Chaume dispensary. Okay, so with that said, we've come to the end of our presentation. So I wanted to ask you, Martin and Dr. Beatrice, what is that one thing that you have come out with regards to this program-based budget?
For me, if it is well done, it is a document that would be very easy for reference. That somebody who is not an accountant, who is not aware of what happens, looking at it with the format that is given, is possible for somebody to understand what happens.
What about you, Martin?
Okay, although I found you on, but there are good terms I have learned on the budget can be promotive and preventive, or it can be curative. So I think I would advise to balance, so that we break the cycle of vicious cycle of treating problematic issues. So at times we need to have preventive services to our community, so that we don't keep on just this rat race of curing things when they have gone beyond repair. So those are the terms I have learned, and as usual, you are quite educative and on point. Thank you.
You're welcome. You're welcome. So, Machakos County has called for public participation in different sub-counties with regard now to the program-based budget, and they have already advertised, so it is starting next week. So with that done, once we get now the budget document, the program-based budget for financial year 2021-2022, we are going now to dissect it and submit it via email to the county treasury. That is what they have said. But if you want to participate in the public participation forums that they have organized in the different sub-counties, you are welcome to participate. So I'm going to share. I'm going to share the dates that they have advertised in our WhatsApp group, so that you may be able now to plant yourselves. And also, even the religious leaders wanted to submit their memo focusing on family planning and HIV. So there are various people who are going to submit their presentation.
So as budget champions, are we submitting anything?
Yes, we are submitting. Once they share, because the religious leaders are part of our budget champions, we are going to submit one.
Okay.
We are going to submit one. So I spoke to the clerk today, and she said that it's going to be published soon. And once it is published, we will be able to, the clerk at the county assembly. Once it is published, we will be able now to review it and submit our memo.
Okay.
Is that okay?
That is okay.
All right. Thank you. It's been a pleasure sharing with you and participating in today's training. So, asante sana. See you next time as we engage in another budget document. Do you know by there is a budget document called Citizens Budget, which is a simplified version of now the budget. So we will also go through that, the Citizens Budget, and we'll also go through the quarterly implementation report, because once we are done with the program-based budget and we submit our memo, now we are going to go to the next stage, which is implementation, where we are going to look at the Citizens Budget, which is a simplified version that the county will have published by the end of June. And then after that, we look at the quarterly implementation reports, so that we see where the money is going to, how is the county utilizing the money that is supposed to be utilized. And then now the Finance Act, so that the finance bill, so that we can see how the county is charging the residents with regard to various tax measures. So thank you, and see you next time.